Welcome. My name is Jessie Souweine, and I'm the Chief Operating Officer here at the Broad. And I'm thrilled to welcome you to our Earth Week keynote panel. I'll be co-moderating today with my colleague, Clary Clish. As you know from the previews and emails, thanks to the Sustainability at Broad team, today's panel is focusing on environmental justice, and it's entitled Environmental Toxins and Public Health. This panel is jointly sponsored by Sustainability, Shades, and Women at Broad. So we have folks from across our affinity group location helping us out here. And we're bringing together 3 speakers who are all tackling issues of environmental justice from scientific perspectives. I'm really looking forward to learning from all of them today and being here with you all. So as always with our webinars and panels, remember to please post any questions in the chat. We do have some that we're hoping to hear from, but we want to use your questions as well to guide the conversation. So feel free to add them as we go along, and we'll get to as many of them as we can. So Clary, I'll hand it over to you to introduce yourself and our distinguished panelists.
Thank you, Jessie. So I'm Clary Clish. I direct the metabolomics platform at the Broad, and I have the pleasure of introducing our speakers. Dr. Jonathan Levy is a professor of environmental health at BU and sits as chair of the environmental health department at the Boston University School of Public Health. His research focuses on urban and environmental exposure and health risk modeling, with an emphasis on related environmental justice issues. He brings a research-focused approach to the ways in which environmental stressors impact marginalized communities to this discussion. Next, we have Dr. Karletta Chief, who's an associate professor and extension specialist in the Department of Environmental Sciences at the University of Arizona. She works to bring relevant water science to Native American communities in a culturally sensitive manner. 2 of her primary tribal projects are the Pyramid Lake Paiute Tribe Climate Adaptation Project and Gold King Mine Spill Diné Exposure Project. Dr. Chief also leads the NSF Indigenous Food, Energy, and Water Security and Sovereignty Program. And finally, we have Dr. Marcus Luna, who brings a local perspective to the conversation as a professor of geography and sustainability at Salem State University and the chair of the board of directors for the GreenRoots in Chelsea. His area of expertise includes GIS analysis and environmental justice, with a particular interest in applications of geospatial technology to environmental sustainability and environmental justice challenges. So thank you.
Awesome. Well, it's quite a distinguished panel. We are very lucky to have the folks here. And thanks again for our colleagues in Sustainability, Shades, and Women for helping to pull this together. So we are going to make sure we get to audience questions, but to get folks warmed up and make sure you are thinking of the questions for these distinguished scholars, I wanted to kick this off by having each of our panelists speak about what environmental justice means to you and how your work focuses on these issues. I think it would be great for Brodies who are participating here today to hear a little bit about what motivates each of you, what brings you to this work, and how you think about environmental justice. So if it's okay, Dr. Luna, I'm going to start with you to hear a little bit about your perspectives.
Sure, thank you for inviting me. I'm glad to be here today to talk to you. And so when we talk about environmental justice, the definition that the US EPA will use, or the State Department of Environmental Protection in Massachusetts will use, is that environmental justice is about the principle that everyone has a right to a healthy environment and to be treated fairly with meaningful opportunity for participation in processes or decisions that affect them, which sounds very nice. But in practice, environmental justice is rooted in the recognition that people of color, so I talk about non-white groups, and low-income people are disproportionately exposed to and affected by environmental burdens. So this could include environmental pollution, environmental nuisances like excessive noise, and of course, risks from climate change. The same groups are less likely to enjoy or benefit from environmental amenities. So access to green space, access to natural resources, equal environmental protection and security. And lastly, the same groups are frequently excluded or ignored in decisions that affect them, ranging from environmental permitting to land use decisions to scientific research. So my goal personally is to be an ally with overburdened communities. And I do that in a couple of ways. One, through my volunteer role on the board of GreenRoots, an environmental justice organization based in Chelsea, as well as in my community-based research. So my technical expertise is in the use of GIS, or geographic information systems, and related data analysis techniques to look at how both burdens and amenities are distributed geographically. So for example, GreenRoots has been leading the fight against a proposed electrical substation in East Boston, which is a neighbor to Chelsea. And East Boston, like Chelsea, is a largely immigrant working class neighborhood that's kind of sandwiched between Logan Airport on one side and Chelsea Creek on the other, which is a federal shipping channel. And it's lined with these enormous fuel tanks that serve the airport and gas stations across New England. Eversource Energy, which is an electrical utility in the region, made a land swap deal with the city of Boston a number of years back to put an electrical substation on a vacant parcel in East Boston, right on the bank of the Chelsea Creek. And for years, the city had promised to clean up that land and create a park, which is a big deal because in East Boston has relatively little open green space, and the community has been fighting for years to get access to the shoreline, which is amazing given that it's surrounded by water. So my role was to analyze the flood risk for the proposed site. And as it turns out, that site is a high risk of flooding in the foreseeable future due to sea level rise and other climate change enhanced flood risks. And the concern is that when a substations flood, they can catch fire and explode, which is not good because it's right near all these wood frame houses and all those tanks of jet fuel. But that's just one element of the story and the community's interest. So in addition to having to host another piece of ugly industrial infrastructure to serve the region, but adds local risk, and in addition to losing an opportunity for promised community accessible green space, the regulatory process of approving this infrastructure excluded limited English speakers, which is a big part of the community of immigrants for which we submitted a civil rights complaint. So my point in telling the story is, one, to give you an example of the kind of thing that I work on, but also to show you how my contribution to that, analyzing the flood risk, is important, but it's also only one piece of the larger environmental justice struggle. And I think a lot of stories have a similar narrative to them. And I'll stop there.
That's awesome. And there's so much in there. I was taking notes of things I know I want to learn more about, but thank you for opening that up and for giving us an example that's very close to us right in our backyard. And so I thought maybe for hearing from our second speaker, I'd go to Dr. Chief, who is not in our backyard, who lives in another part of the country, and have her tell us a little bit about how she accesses this work and how she thinks about environmental justice. Dr. Chief.
Thank you. I also want to thank Broad Institute for having me here today. It's an honor to be on this panel. I would like to speak to what environmental justice means to me from an Indigenous perspective. As Dr. Luna spoke about, environmental justice meaning respecting the right to a healthy and equitable and clean environment, that is actually central to Native American belief, spirituality, culture, identity, and values. In the Indigenous worldview, every living thing in the environment has a right to be part of that ecosystem, and in addition to human life. And so Native Americans, their livelihoods and their culture, their spirituality, all depends on their environment. They have sacred spaces that are based on environmental landforms, water sources, various keystone species such as salmon. So environmental justice is very central to Indigenous worldviews. And that is something that I often engage in dialogue with my colleagues who are non-Indigenous and students when we go into Native American communities, because when you're talking about various types of standards for safer water, looking at the maximum contaminant levels set by EPA, as well as the aquatic life standards for water, those two one would think would be different, but to an indigenous person, they actually care very much about those aquatic standards, even though they may not be using that water for drinking. They're concerned about the quality of that water for the ecosystem. So in that sense, when you're involving indigenous communities in the dialogue about environmental protection, where these laws are being developed and enforced for their protection, it not only relates to people, but it is a much more a holistic view of the ecosystem. And so that's where it is very different for indigenous communities. It also means that it is recognizing tribal sovereignty. Tribes, federally recognized tribes, have their own sovereignty. And that is unique and critical when it comes to environmental laws. For example, some tribes have treatment as a state status where they can develop their own water quality standards on their tribal lands. In addition, they have cultural practices that are based on the environment. They have traditional knowledge, a repository of knowledge that has been gathered for millennia. And then they are inherently tied to ancestral lands that may not be necessarily the defined boundaries that the United States eventually left them with, which are often marginalized lands too. So all of that is important to consider in environmental justice. And I also want to recognize that there has been a long history of an indigenous leaders who have been working on this for many, many decades during the environmental movement to talk about the disproportionate impacts of environmental pollution on tribal lands. For example, on the Navajo Nation, we have the history of uranium mining that stems from the early part of the 20th century, where a lot of this mining was not regulated and was not cleaned up. And so resulting in many, many people getting exposed to the abandoned uranium mines, leading to cancers and many other elements that were even passed on to generations. So, that's an example where environmental justice, of an environmental injustice, and also how indigenous environmental leaders have rose to advocate and raise their voices. And more recently, I would give an example of the No DAPL, which is an opposition of Native Americans to the Dakota Access Pipeline, mainly because this oil pipeline was going across their ancestral lands, and they were very concerned about potential pollution, and these waters are sacred to them. And so there was a large outcry from indigenous peoples from those areas, but also uniquely enough that it was a unified voice where other tribes came from across the United States to join them to elevate their voice to oppose this pipeline. And in Indian country, there is unfortunately a long history of environmental injustice. Thank you.
Thank you. Sorry, I had my mute problem. It's great to hear about the work you do, and I appreciate the examples that you shared, and we're definitely going to want to come back and hear more about that work. Dr. Levy, can you round us out, giving your perspective on how you think about environmental justice, and then we'll start delving a little bit deeper with some further questions.
Sure, no, thank you, and thanks for having me here today. So I guess first, if you go back in time a bit, some of the earliest days in the environmental justice movement really focused on things like hazardous waste sites and how they were disproportionately cited in communities of color. But I think as you heard from the previous speakers and as the literature has shown, environmental justice is much broader and deeper than that. And I think as we look at things in 2021, it's everywhere. It's ubiquitous and really cuts across a lot of aspects of everyday living. So one example that I've focused on relates to housing and the built environment. So we know that there certainly have been a lot of historically racist practices related to housing, things like redlining and restrictive covenants, as well as contemporary racist practices. And that, as Dr. Luna said, has led to disproportionate exposures to both the goods and the bads in the home and neighborhood environment. So lack of access to green space, increased exposure to traffic-related air pollution, increased exposure to noise, increased indoor environmental exposures, all those things kind of stack up on top of one another, and they pattern with race, ethnicity, and they pattern with socioeconomic status. And one thing that we've looked at in our research is just how these things do tend to stack up and multiply. So for example, we looked at air pollution across all of Massachusetts, and we showed that there were racial ethnic disparities in outdoor air pollution levels across the Commonwealth. So both non-Hispanic Black and Hispanic populations had higher exposures than white populations in Massachusetts, even within urban areas. So this was not an urban, suburban, rural differential. Within urban areas, you saw those disparities. But then if you layer on top of that, who tends to live in homes that allow for more infiltration of outdoor air pollution indoors? We spend most of our time indoors, and so that's where we receive a lot of our exposure. You see the same types of disparities in who has access to tighter housing versus housing that lets more pollution in from outdoors. And so when you layered those things on top of each other, the disparities accumulated. And we showed, for example, that the low outdoor air pollution places that had tighter homes, that had 2% Latinx populations, the high outdoor air pollution communities that had leakier homes had 20% Latinx population. So some stark disparities, and you can continue to layer on different stressors and see the cumulative effects. And that relates broadly to another thing that I think is important. I've tried to focus on in my research, which is the effect of cumulative exposures, because people are exposed to many things in their everyday lives. And as I said, many of those things tend to stack up on top of one another and associate with race and ethnicity because of this whole host of different policy practices over time. And so environmental justice to me means considering all of these simultaneous exposures and understanding their health effects. And I'll confess to not knowing entirely what you all do at the Broad, but I know, GWAS studies looking across the genome is one element. I think we need a lot more emphasis on, EWAS and, across environment exposure studies, where we understand the association of simultaneous exposure to many environmental factors and their joint effects. And then, of course, carrying that through to policy and policy action, moving as far upstream as possible. Because if you're focusing downstream on dozens of different disproportionate stressors, it's kind of hard to knock each one down. If you go farther upstream to the factors that led to those disproportionate exposures to begin with, you can start to disentangle and unravel. And that kind of solutions orientation is something that we've tried to focus on. I'll stop there.
Great. Thank you all for giving us a little background on sort of who you are and how you come into this work. Clary, I wonder if you want to kick us off with some questions from your side, and then we'll also be looking at the questions that are coming in through the audience.
Oh, okay. Well, I do have one audience question to start with.
Great.
Right there. So I think this one really is for perhaps Dr. Levy from Cassia Handing. She asks, what are the towns, cities in Massachusetts that show the most disparities in terms of environmental justice between white communities and communities of people of color?
I mean, it's a good question. Unfortunately, it's a long list. Dr. Luna may have some insight on this as well. The Commonwealth has environmental justice maps that more relate to sociodemographic factors than exposures, and those certainly light up in a large number of communities. You do tend to see the same communities hit over and over again by a variety of factors. Again, if you look at patterns for COVID, for example, is, unsurprising to anyone who's been in the public health or environmental justice arena, that you saw disproportionate effects in Chelsea and Lawrence and in Lowell, as well as in Boston and specific neighborhoods of Boston. And so it's, some of these communities that tend to have a lot of certainly industrial land use siting, have overcrowded housing, have lack of access to green space. Again, all these factors do tend to stack up on top of one another. But unfortunately, it's not that you can point your finger at one neighborhood or one community and say that's where the problem is. It's quite widespread and cuts across a number of different communities of color.
Thank you. Dr. Luna, anything to add there or no?
Yeah, well, I think Dr. Levy said it really nicely, and I agree with that entirely, that it's complicated to identify a particular community. The state, Massachusetts, just passed new legislation that, in addition to laying out a climate mitigation roadmap, has also created for the first time environmental justice legislation for the Commonwealth that defines environmental justice communities. Previously, it was all done through executive orders, and so now it's a big deal. And so the communities identified are based upon their demographic characteristics. So communities that have a high proportion of non-white people, minority, communities that have a high proportion of limited English speakers, and communities that have a high proportion of lower income people. And that's usually defined as 200% or less of the poverty level, because the poverty level is ridiculously low. The challenge is that identifies communities that we know historically have been excluded from processes and overburdened, but they don't identify where the stressors are, where the environmental pollutants are greatest. And the problem with that is not just that's a complicated scientific question, but it also depends on the context of the question and what you're asking. So for different burdens, you might get a different pattern across the landscape. So if you were looking at air quality versus say looking at housing quality versus say looking at access to green space, you might see a different, array of issues and array of communities that fall into that blanket. So the policy is broad, but it does kind of echo our kind of general understanding of where the problems lie in the landscape.
So we can so we do research at the Broad. That's a big piece of what we do. And we do research that is trying to have impact on the world. And so I wonder, as another sort of foundational question to set our audience up with some understanding, I think it might be helpful for people to hear from you all in your research. How have you understood or made connections between climate change and public health? Because I think understanding kind of the research that, all of you have talked about your research, you've also talked about advocacy, and you've talked about regulation and legislation. There's many aspects of this environmental justice work, but I wonder if we could start with the research and sort of how has your work or the research you've been involved in created that link between understanding the impact of the climate and climate change on public health, so people can understand that basis, and then maybe we can move to some of the other aspects of the environmental justice work that is based upon that research. And I'm happy to have anyone, I don't need to cold call, any of our panelists maybe want to jump in and answer that question around the links between climate change and public health.
I mean, I'm happy to start. We have an environmental health disparities research center, and climate and health linkages are one of the elements of it. So I could go on and on, but I won't. The big picture of there's a lot of pathways, and they're in the here and now. Or this is not a 2030 or a 2050 question. This is a now question, and obviously we're most used to thinking about extreme weather events. The increased number and intensity of hurricanes, for example, and their implications. Those certainly have an effect on both physical health in the acute sense, but also mental health over a longer time horizon. But there's also a lot of other important pathways. Heat exposure is quite important, especially in urban areas and a lot of places that lack green space and are urban heat islands. Those effects are intensifying over time. Certainly air pollution remains a concern. Air pollution is getting better in Massachusetts, which is a good thing, but the changing climate can actually make that more challenging over time to maintain cleaner air quality, and globally air pollution remains a significant concern. Yeah, the thing that we try to focus on, which I don't know if we'll touch on later, is rather than emphasizing all of the problems that climate change has for health, is all the health benefits that derive from climate solutions, in part because it certainly is a more positive frame, and because a lot of those health benefits, some of them relate to climate change itself, and some of them are, kind of in the jargon called co-benefits, where you invest, for example, in public transportation systems, or bike lanes and so forth. You're reducing your carbon footprint, but you're also allowing for more physical activity, you're improving local air quality, and so you're doing things that benefit the health of the communities in the here and now. So we really try to emphasize, what are the health benefits now of taking climate action, not what are the health benefits in 20 or 30 years, what will happen in your community today, tomorrow, and next year if you take climate action. And there's a lot of mechanisms by which health can improve.
Other thoughts on that question?
I can chime in on that question. So in my work with Indigenous communities, I lead the Native Nations Climate Adaptation Program. And in that program, we are working with tribes to create adaptation plans. Currently, Native lands and peoples are experiencing climate change impacts already and are anticipated for these impacts to be even greater. For example, in Alaska, where there are over 227 tribes, they are experiencing warming that's impacting their ability to get food, because many of them engage in subsistence practices that requires them to travel across the ice and the glaciers. And so with the warming, it's becoming unsafe for them to do so. And so that amplifies food insecurities. In addition, in my work with water, tribal waters is experiencing climate change impacts in unique ways. So a lot of the much of the tribal water infrastructure may not be designed to accommodate these climate change impacts. Some of the water infrastructure may be either lacking, poorly maintained, or needing upgrades. And so, for example, if a water treatment facility is not designed to treat water, changing water qualities, then that's a health impact, because water's not clean water is not available to the people. And so access to clean water is a huge issue. And then that also leads to waterborne diseases that may occur with changing water temperatures. And so the cost to get clean water to the people is also financial burden for tribes who may not have the financial resources to address it. Already in Native American communities, 12% of Native American homes do not have access to clean water. That's, in stark comparison to less than 1% of the general US population. So adding that climate change impact onto their water sources to already this high water insecurity is huge. And then flooding and drought is also a huge impact in many tribal communities like the Southwest. Drought has caused water levels in these alluvial aquifers to go down. And so many tribal members depend on these shallow groundwater sources, not only for drinking, but also for ranching and agricultural practices. In the Wallapai tribe, they had to sell off hundreds and hundreds of their livestock because they just had no water. And then, you know, in the higher elevations and the forested regions, fire is another huge impact with the White Mountain Apache tribe. They're surrounded by coniferous forests, and with increase in fires, not only are they losing valuable home sites, but also air pollution to vulnerable community members. In the plains region, there have been incidents where drought had caused water to go below the intake valves, resulting in a public health emergency where people no longer had access to water. So I think water is a huge issue that directly relates to public health impacts in Native American communities. But I also do want to say that agree with Dr. Levy on heat. You know, many tribes, they're both set in rural and urban settings, but especially for Native elders, they may not have, you know, cool spaces to go to. So that requires an emergency response plan to identify elders that need to be temporarily relocated to cooler spaces. And then with storms as well, when in rural tribal communities where people live very far apart from each other, how are you going to get food and other services to families that are remotely located? So, so these weather events definitely does lead to health issues. Thank you.
Thank you very much. Clary, do you want to take us to the Q&As from the audience?
Sure, yes. We have a couple of questions here. One of them is sort of related to what we do at the Broad. And it simply asks, have any of you had experience in the direct impact of the biotech industry, or say the pharmaceutical industry, of which, you know, our work is somewhat related, on environmental justice? And are there issues that we in particular should be keeping in mind here? Or are there things that, you know, as an extension of that, are there things that we can do from our perspective to contribute in a positive way?
I've got a quick one for that one. So it's not going to be the one you want to hear, though. So at GreenRoots, we recently received a communication from the EPA looking for how to allocate fines that were applied to a biotech company in Arlington because they had exceeded their emissions permit in terms of what they were emitting. And so it reminds me that whenever we're dealing with any kind of industry, you know, from community perspective, we're really concerned about the level of, you know, neighborliness and compliance in terms of operations, because particularly for larger things. So it's a really obvious one, but it's kind of an important element, and it's something that, you know, we deal with regularly along with other industries.
Thank you. So there's another question, I guess more general, for let's say white people in the environmental justice struggle. How can we center the voices and narratives of non-white people, those most affected when pushing for change?
Well, I'll launch again. So one of the things that GreenRoots works to do is to work with allies. And I think a lot of community-based organizations are always looking to work with allies, but one of the frustrations that I think goes way back within the tensions within, like, let's say the environmental movement, is that even when allies, you know, alliances happen, it is not uncommon for the white-dominated, wealthier groups to kind of begin to dominate the conversation or the limelight, and that's because of historic power and wealth differences. And so one of the things that is really helpful is that when alliances happen and there's a conversation between groups, that there's a deliberate effort to not allow that to happen, to not overshadow the groups that you're trying to work with. And that means, being aware of whether or not you are, taking out oxygen in the room by talking too much, or whether or not you are, working to like elevate the opportunities for involvement by the other group or individuals, whoever you're working with. And then listening. I think that's a big part of it too, is, I think as experts, it's hard not to, come in with, all of our tools and our expertise and say, look what I can do for you, and here's what I think you need, rather than arriving and saying, what do you need? What do you want? What are your priorities? And working from that, which it can be very disruptive as an expert or an academic in particular, or a researcher, to operate that way, because it's not convenient for your research schedule, your funding. But from a community perspective, and having been a perpetrator of bad research in other communities and not knowing that I was, doing that, I can speak from experience that's an important thing to consider as you go out. And certainly your skills and your resources are desperately wanted. And I think there's ways to do that very constructively, to work alongside communities that you want to work with.
Thank you very much for that important perspective.
I would like to build off of Dr. Luna's point about listening. I think listening is so important and central, especially in the work that I do with Indigenous communities. Listening is critical. Listening to their concerns, reaching out to them, understanding what their needs are, giving them the voice, letting them drive the conversation, involving them in every step of the way, being transparent in what you're doing, give them the data back, allowing them to be your equal partner, where they're participating in not only the dialogue, but they're also part of the data collection, dissemination of the results, whether that's co-presenting or co-authoring. But I think, a lot of us as scientists, we think from a Western science view, but especially with Indigenous communities, that does not work. It's important to decolonize our approach in the way that we do research, where the community's perspectives and culture, their needs are central in the work that we do. And for example, in my project with the Gold Key Mine Diné Exposure Project, I trained my team to do this because they were not aware of cultural protocols. They were not aware that they were talking too much, and they were taking the talking space of the community. And especially culturally, the elders are highly respected. And so typically it's not based on your education level or what position you have, but your status in the community in terms of your generation. So in Indigenous communities, it's really important to listen to the elders and allow them to drive that conversation. I think that's one way is really important, is listening.
Thank you.
If we could just,
I think Dr. Luna and Chief covered the base as well, but just to reinforce to everyone who hasn't been in this space, I mean, there's a whole domain of community-based participatory research, which I think we've tried to adhere to, and I think Drs. Luna and Chief as well. That's just important to follow, which really engages the community at the front end in the planning process, all the way to the back end of dissemination and everywhere in between. And I think if you fall short on some of those dimensions, it doesn't make the work impalatable, but it just makes it much more challenging. So I think it's just incredibly important to stick to that and to acknowledge where you fall down, and acknowledge that in some projects maybe you can't meet the mark on each of the elements, but just to be upfront and explain why. But again, having the process driven by the needs of the community, I think is essential, because as much as you'd like to think that you have expertise and experience, whether lived experience or academic experience, unless you're grounded in that community and engaged in the day-to-day struggle, you don't really have a good perspective on things. So I think, listen, all be at the table and be willing to be challenged and told that you're wrong and be willing to change.
I wonder if we could stay with you, Dr. Chief, for a second, just to follow up on that. I understand that COVID really hit the Navajo Nation really hard, and that you were very involved in leading the University of Arizona's campus effort to provide water and other resources, and that ultimately the Navajo Nation had a very high vaccination rate. And so I wonder if you could just use that as maybe an example of how some of the practices we were just talking about in terms of working with communities and bringing science to bear and listening maybe was part of that, or just maybe share a little bit about that.
Sure. Thank you for that question. The history of how the partnership came to be stems from, over a decade of working with the Navajo Nation with in relation to the University of Arizona Superfund Research Program through the Community Engagement Corps, as well as a project looking at the impact of the Gold Key mine spill on the communities, looking at short-term exposure and risk perception. And then building upon that to look at food, energy, and water insecurities, and how technologies can be co-designed with the community that are more appropriate for off-grid communities. And so that's all in, many of that's all in partnership with tribal colleges, specifically Diné College. So the more recent event with COVID-19, that was come about through invitation. So we were invited to by the Navajo Nation Council to present on these off-grid technologies, mainly because water was a big issue. More than 30% of the Navajo people do not have access to running water. So with the CDC guideline of washing your hands for 20 seconds, what are you going to do? Are you going to drink the water? Are you going to wash your hands? So hygiene is not a priority. Feeding your animals, watering your plants, your crops, and drinking the water are more priority than hygiene. And so they were interested in these off-grid technologies because they had received the CARE funds, and they wanted to direct the CARE funds for COVID-19 impacts to finding ways to get water. So through that invitation, we entered into many conversations centered around tribal consultation. So the Arizona Board of Regents has a tribal consultation policy where we have to engage the tribe through formal processes to understand what their needs are, come to an agreement of what the partnership will entail. And then that developed into us being invited to the Navajo Nation Water Access Coordination Group, which is a group of federal, state, nonprofit universities and research entities coming together with the Navajo Nation to find ways to construct more watering points, get hand washing stations out to people, getting water storage containers. And then for my team, it was coming together to compile our water quality data, to provide that data accessibly to Navajo leaders and decision makers to understand what water qualities are out there. And so from all of those conversations, we've been continually enhancing our work, mostly with off-grid piloting of these off-grid water solar systems. And then also on the health side of it, understanding what are the risk factors to COVID-19. The Navajo Nation had one of the highest per capita, actually per 100,000 COVID-19 infection rates in the United States back in May. And why is that so? That was a big question. Is it because the people don't have access to water? Or is it other comorbidities such as diabetes? Native Americans have one of the highest rate of diabetes. Is it those existing comorbidities? Is it past environmental exposures to uranium and arsenic? Or is it that they're living in multi-generational households, or there's so many different socioeconomic factors. But through some preliminary analysis of publicly available data, we did find that language was negatively correlated to COVID-19 infection rates. So that's where public health messaging is so important, that not only is it in the main language of use, but also that it's culturally appropriate and clearly communicated. So we're continuing to work with the Navajo Nation regarding this. And I'm very happy to see the Navajo Nation President Nez continuing to advocate on water security, getting water to the people, as well as understanding what the risks are, and then having a really strong public health guidelines. They have had weekend lockdowns, daily evening curfews for many months. Wearing masks and social distancing is important and enforced. Like many areas across the United States, they have a time for elders to shop, and that continues on. And so the public health aspect of it was very successful. And then in terms of the vaccination, I believe there's a doctor doing a study on this in tribal communities, where he found that tribal communities have been the most successful in vaccinating their communities. The last percentage I heard was, I believe, up to 80% of the Navajo Nation have been vaccinated. And you don't need to make an appointment. You just gotta get in line and get your shot. So it's pretty easy. And the Navajo Nation president has been very successful on all of those COVID-19 precautionary measures. And I look forward to continuing to understand what those risk factors are.
Thank you so much. I think we have a question from the audience, but I do want to just highlight some of what you talked about, Dr. Chief, of it sounds like the collaboration that came about around the pandemic was based upon years and years of partnership and years of collaboration and developing pathways to communicate and work together. And my sense from the other panelists as well is, the research is great. We can have all these great ideas, but it's so critical to have the open lines of communication, the ability to listen, and the trust that is the basis for being able to actually have impact. And it sounds like that example really elucidated that. So thanks for sharing that. Clary, do we have more from the audience?
I was muted. Sorry, we have one more. We have a question from the audience. So the person asks, do you believe government agencies such as the Environmental Protection Agency or the Department of Energy or others would benefit from collaborating with, say, indigenous communities or community groups representing people of color on various, I'm kind of generalizing the question that was posed, but on various issues. So I think that previously, each of the panelists commented on engaging with the communities that are particularly impacted and listening. So the question is really, have there been good opportunities really to collaborate with large federal agencies, and are mechanisms currently in place for groups to have input at that level? And I know, and to Dr. Luna, in the case of more at the more local level, so working with, are there currently good mechanisms for say the people of Chelsea and other communities to work with the local governments and be heard?
Sure, that's a great question. And there's a lot in there. And I think also Dr. Chief probably has a lot to say on that too, because the relationships between the federal government and communities can be very different for tribal nations and for states and cities and towns. So Chelsea, city of Massachusetts, actually benefits a lot from Environmental Protection Agency programs that have already been built that are trying to direct resources locally and to have we have a red phone line directly to the Region 1 EPA administrator when we want to talk about things. But actually the federal government for cities and towns is not terribly useful on a lot of things because a lot of the policies work at a very broad scale. And so most of the big decisions that we're concerned with are happening by state permitting agencies. So it's the State Department of Environmental Protection that's usually in our crosshairs when it comes to a variety of disputes. And then, the cities and towns, they're the ones that control zoning, which basically controls what can be built where and a lot of the rules about what can happen. And so the kind of day-to-day interactions are going to be with state regulators and with city officials. And Chelsea has a pretty good relationship with a lot of its nonprofits that are advocating for the community. And certainly with the pandemic, that was really, really amazing to see because the city had low capacity to really respond quickly. And it was really the nonprofits in the community that kind of banded together really quickly to organize and start getting resources out to people who, lacked food. And we had a lot of people in the city who were going to go hungry. And so they got donors, they got lined up money, and they actually ended up routing for the city the resources to get out to people. And then that's continuing with, getting out the message about vaccination and getting people to make appointments. So, there's a lot of really great, innovative, creative stuff that's happening to keep that line open. But it's, it's never always one thing. We still have a lot of things that we fight over. So, I think there's good stuff, and then there's stuff that still makes us mad that doesn't work out the way we want it to. So it's always a work in progress.
Thank you.
Yeah, and building on that briefly, I 100% agree with Dr. Luna that, independent of what's happening at the federal level, I think there's a lot of local action and local emphasis that drives things. Even if you go back to the early days of the pandemic, or the fact that Chelsea was being disproportionately affected didn't come certainly from the federal government, didn't come from the state government. It actually came from recognition among community groups and then local scale data collection that was actually facilitated through the chiefs of police of various hard hit communities. So, it was the local action that then percolated up and influenced state policies and state communications and actions. And if you look at climate action, which I think has been one of the themes talked about, kind of climate change and health, again, there's a large difference certainly in the federal government now versus the prior administration, but climate action plans are really being proposed and acted upon at a city level. And so there are obviously federal government matters, state policy matters, but a lot of these actions are being pushed at the local level. And so that means there are opportunities to engage at the local level and influence some of the policies and activities. So I would certainly encourage people to push for federal policy change, try to influence environmental justice legislation and so forth at the state level, but really try to drive action locally through local engagement, local empowerment.
I think we just have a few minutes. Clary, there's one last question in the chat that I wonder if we could go to, and then we're going to thank our panelists and wish them well for the afternoon.
Great. Yeah, thank you, Jesse. So this one really, I think, is for Dr. Levy. So touching upon redlining, do you believe equitable dispersion of property taxes to different communities within each state would help address the threats in public health in lower socioeconomic communities and indigenous communities?
It's a good question. And I confess I don't know the answer to it. It certainly would not hurt, obviously. I don't know if it would solve those problems. Some of the issues that have happened with redlining are issues within communities, as well as things that exist across communities. So in certain cities, neighborhoods that were carved out historically as kind of being designated for communities of color, and others that were inaccessible to communities of color. And that has led to large scale, racial segregation and the associated effects. So some of this has to get unpacked within communities, kind of grappling with these historical legacies and thinking about zoning, land use patterns, and kind of practical actions that can be taken in the here and now. It's taken us a long time to get to where we are now, many decades of the historically racist policies. And so it's hard to undo them overnight, but I think we have to at least start by recognizing them, recognizing that land use patterns and who has access to what space is not randomly distributed. A lot of it was, predetermined and deliberately structured many decades ago, and we have to take kind of deliberate and aggressive action to try to untangle that. And so again, I think, some mechanisms to share resources between communities could certainly help. I think mechanisms to try to address land use patterns within cities are also quite important.
Great. Well, to give people a few minutes to get to their next Zoom at 3, I'll close us out. I want to give a huge thank you to all of our panelists for coming together. You don't know us very well, but we really appreciated getting to hear from you and getting educated. I also want to give a big shout out to Alham Sadat, Liz Lawrence, and Alana Folsom, who put this together, and Russell Marakfer, who is our behind the scenes technology, making sure that the video worked. So thanks to everyone for coming together and listening and learning. We really appreciate it, and hope you enjoy the rest of Earth Week. So thank you. Bye-bye.
Thanks very much.